Health officials say one of the best defenses against the spread of COVID-19 is to socially distance. But what if you can't socially distance? What if you're in prison?
There's no social distancing. They're not allowed to have alcohol-based cleaners. They are not given gloves. Only recently, the private prisons, we understand, have been giving out masks.
Advocates say stay-at-home orders don't work when your home is a jail, with hundreds of others, both guards and inmates.
For those confined in these tight spaces, the population is so dense, it's impossible for individuals to social distance. And we're starting to see the number of infections on an increase.
Not just infections, but deaths. The first Arizona inmate to succumb to coronavirus died in a Tucson hospital 2 weeks ago, and a second inmate death was reported Friday in Florence, according to news reports. The Arizona Department of Corrections reports just 49 cases have been found in a prison population of more than 41,000 inmates, but only 199 inmates have been tested so far.
Easy to say that the numbers are low because you're not testing.
They haven't tested anyone. Just like out in the general public, we've been hearing a lot of complaints directed toward the governor and the Department of Health Services about the low percentage of Arizonans who have actually been tested.
Those in the prison have few ways to protect themselves, Ham says.
There's just a terrible shortage of cleaning supplies, soap. So every single thing that's been recommended for all of us to be doing as preventive measures is not able to be done in a prison.
And the disease is not just a threat to inmates, but also the correctional officers watching them.
Roughly 120 or so enter the prison from the community every month, newly incoming inmates. And then the staff are going in and out, 24 hours, three shifts a day. And they are all going home to their families, to their children, to the grocery stores, to the churches, everywhere where you and I shop. So we have to be concerned about this.
She calls it a community safety issue, not just a prison issue. And the current handling is what Ham calls a blueprint for disaster.
Whether you care about inmates or not, and many people don't, they have zero sympathy. Those staff members are going in and out of the prisons every single day. And so they are bringing whatever they pick up in the prison back out to the community.
In Washington, Gabriella Khalaj, Cronkite News.